I was looking for a summer internship, and Uganda Village Project was listed on Handshake. So I went on, applied for it, and got hired. Going out there to do health education to rural Ugandans really brought back some of the aspects that we're learning here at CGU on health education and health promotion, and really catering health education and health needs to diverse cultures.
It was back in 2014 when I got a phone call from Dr. Linda Houston, who is a chief cardiac nurse at the Loma Linda Sachs Clinic. She gets a lot of heart failure patients into her clinic. About 30 to 40% of those same patients were getting readmitted back to the hospital within 30 days. And she also made a very interesting comment. She said, once they leave, I have no view into their lives. So my students and I, we worked with them and we designed a remote monitoring technology solution for them. And through the app, they would input their symptoms, their conditions. We would give them motivational messages to alter behavior. In a 6-month trial, not one was readmitted back.
We are currently working on a project looking at caregivers of cancer patients, and specifically those who are in continuous treatment. We felt this is an untapped need. These are caregivers taking care of people who are going to be on treatment for the rest of their life. And nobody's taking care of the caregiver in this.
Research is a social effort. It requires people to gather, to get together and think together about the research questions, the problems, the policies, the solutions.
When we come together, we are bringing certain unique viewpoints and perspectives, and that is necessary to solve the big healthcare challenges going forward.
There's clearly a revolution going on in how we think about human health, and it's all about convergence. All of these areas, these domains and disciplines in medicine and behavioral health, or now more than ever, areas like epidemiology and population health coming to the fore. And that integration is exactly what CGU does so well.
This project that Seda and I are working on came from a conversation. Both new faculty at CGU looking to do something different, and we just started chatting.
We sit down, we think together, we put together these research designs, and we go over the literature. We have these conversations. And in that sense, it makes me feel passionate about what I do, but it makes me feel also humble.
I know my capabilities and kind of the tools that I have, but I don't know what a health scientist might have. But
and vice versa.
Exactly. If we don't have those opportunities to talk, we wouldn't be able to figure out how to resolve these complex issues.
We have a vision, we knew what we wanted to do, we knew how we wanted to do it, but we really needed a place that we could bring researchers and students together. And so then along came a longtime partner to really step up and make it all a reality.
The San Manuel Band of Mission Indians. This project, this idea resonated with them. And so with the help of a generous gift, $14 million, we were able to purchase the Huntley Bookstore building, the iconic mid-century modern building. And with the partnership of the tribe, we're turning it into the Yahavatam Center for Health Studies, all aimed at integrated health and well-being for vulnerable populations, and it'll become the home of our School of Community and Global Health. And now we're perfectly positioned with our partner to take on these grand challenges.
There's no way that one researcher or one area of research even can meet the needs on health education and health promotion.
We are entering a tremendous era of health innovation. We are working with genomics data, we are working with proteomics data, we are pushing the boundaries with medical devices.
We're nimble, entrepreneurial, transdisciplinary. We care deeply about having a positive social impact. All of that is in our DNA. The Yahavatam Center for Health Studies will show the world what the future of human health looks like. And we're so proud that it's happening here at CGU.